My name is Dr. Duncan Nyukuri. I'm an infectious disease specialist at Kenyatta National Hospital. During this current Mpox outbreak, a lot of people have questions. There's a lot of information circulating around. And my goal today is to provide answers to some of these questions on what Mpox is, and at the end of the day, on how to prevent yourself from getting Mpox, and eventually how to keep yourself and your loved ones safe. Mpox is a viral illness. It's very similar to smallpox, which was eliminated in the 1970s. Usually, it's found among animals in West and Central Africa. Human beings get infected when they get in contact with these animals. Infected human beings can subsequently spread the disease to other human beings when they get in close contact with them. Mpox spreads through several ways. The most common way, and this is the way it's spreading during the current outbreak, is through close human-to-human contact. Close human-to-human contact can occur during instances like hugging, cuddling, kissing, or during sexual contact. Also, Mpox can spread through close face-to-face contact, through talking or through breathing. When you also get in contact with contaminated material, which has been used by an infected patient, material like bedding, towels, cloths, or other items, you can also get infected. Lastly, an infected mother can potentially transmit the infection to an unborn baby. In most patients, Mpox is a mild disease, and they will recover without a lot of interventions, with minimal interventions. In some populations who are at high risk, they can get severe disease, which can lead to complications. Almost anyone can get Mpox when you get in contact with an infected patient. However, there are some populations that are at a higher risk of getting the infection. Healthcare workers, by nature of their job, are at higher risk of getting infection as compared to the general population. Those who are taking care of patients who have Mpox, or those who are in a community where there is a community outbreak, are also at a higher risk. People who have multiple sexual partners are also at an increased risk of getting Mpox. It is important to take preventive measures in order to stop the community spread of Mpox. As we have said, Mpox is primarily spread through close human-to-human contact. Therefore, you need to avoid close contact with an infected patient. Also, if you're taking care of someone who has Mpox, then it is important to adhere to infection prevention measures to protect yourself. So you need to wash your hands frequently. You'll need to avoid getting in contact with contaminated material like bedding and clothing and so on. And also we said Mpox is spread through close contact during sexual contact. Therefore, you need to avoid having multiple sexual partners. A person with Mpox can be taken care of at home because most patients with Mpox will present with mild disease. However, it's important for you to be evaluated by a healthcare worker to determine if you are a candidate for home-based care. If you are a candidate for home-based care, it's also important to know where you are going to be taken care of. If you are going to be taken care of at home, you need to have a single well-ventilated room that you can isolate during the duration of the infection. Also, you need to have access to food, you need to have access to clean water and sanitation products. There is an Mpox vaccine that has around 85% protection, but this vaccine is not universally available. This vaccine is only recommended for people who are at high risk. Currently, we are not recommending mass vaccination for the general population. Of note, I need to mention who this high-risk population is. A high-risk population, these are patients who, if they get Mpox, then they are at risk of getting severe illness. Here we're talking about people whose immune system is weak. For example, if you have advanced HIV and it's not well controlled, if you have an underlying condition that has put your immune system, that has weakened your immune system. We're also talking about children, especially under 5, and also pregnant women. This group of patients at a high risk of progressing to severe disease if they get Mpox. I'd like to say Mpox, in the vast majority of the population, it's a mild disease. So far among the patients we have taken care of at Kenyatta, we have not had any deaths. And we have treated them and we have discharged the majority of them at home. So people should not panic. Also, as I've said, we should avoid unreliable and verified information. People should seek information from verifiable sources that I've mentioned, and if they need any more information, we are there to help them. Our hospitals are equipped and prepared to handle any cases. So if you have, you're suspecting that you have been contacted or you have Mpox, kindly visit your nearest health facility.